When people come into the office and they're looking for neck pain relief, the first thing they want to know is, how quickly can I get out of it? How can you help me? But the second thing that they want to know is what is actually causing it. It's always confusing to people how things just start that didn't exist before, how they kind of come on slowly. Maybe it's been going on for a couple of years, or maybe they woke up with it. So they're always curious as to what is actually causing the pain itself. So I wanted to talk to you a little bit about that today. So there are three things that we really focus on here in the office when it comes to neck pain, and they are the three different structures that make up the cervical spine. So there are the vertebra, the bones in the spine. Those are where we're going to be palpating and feeling to see if anything is out of alignment or rotated the way it shouldn't be. And with the chiropractic adjustment, we're going to move those back into place. The second thing are going to be the muscles that support the spine. So if there's one side that's too tight, one side that's weak, or maybe there's too much tightness going on, we'll look at those to see if that may be causing the problem. And then the third thing are the discs in between the spine. So we'll go through each one of those really quickly. With the vertebra, the biggest thing that really matters are two things. The alignment of the spine, so making sure that the spine is nice and aligned where it's supposed to be and that they're moving the way that they're supposed to. And that there's a nice curve here. It's a reverse C curve that allows the head to stay in the place that it should. That curve allows the weight to be distributed throughout the spine. As this curve starts to go away, just because all of us are on our cell phones and looking at computers all the time, and so our heads are in flexion like this, as that happens, that spine starts to straighten out, and we'll talk about how that affects the rest of the structures as well. So that curve is really the thing that we're looking at that affects all three of the structures that we're going to talk about. So that's probably the most important thing, but that alignment is what we're looking for when it comes to the adjustment to make sure that things haven't gotten stuck out of place. The second thing that we're looking at are the muscles along the spine. So when we talk about the muscles along the spine, we're talking about the paraspinal muscles. They really help to support the spine and help to move it the way it's supposed to. If you've got tightness on, let's say, on the right side versus the left, obviously that's going to start to put pressure. If the muscles are attached to the spine, they can start to put pressure on the spine and start to move those vertebrae out of alignment. The other thing that happens is these muscles that are here, in the body, the nerves that come out of the spine, if those muscles, press on the nerves, that can create problems as well. So muscles are always, usually the muscles are more of a symptom than the cause. Like if your spine's not moving right, or that curve is starting to straighten out, those muscles become a symptom as opposed to usually the thing that's causing the neck problems to begin with. And then the third thing that we're going to look at are going to be the discs. So the discs are the shock absorber in the spine. They also work to give space around the nerve so that the nerve has room to breathe. Now the nerve is taking the information from the brain, goes down the spinal cord and then out through these spinal nerves to go out to all the structures in your body. So everything that happens in your body takes place through these spinal nerves. So if the nerve is being pressed, that's what's going to create the pain. So the original question is, what is causing my pain? It's always going to be some kind of pressure on this nerve, whether that's caused by the joints or the vertebra being out of alignment, whether that's caused by the muscles pressing against it, or if these discs start to bulge, they can actually bulge backwards. So if any of you have ever heard of degenerative disc disease or a bulged or ruptured disc, this is what we're talking about. So the disc should be nice and normal, should be full, allows that hole to be nice and large so that the nerve can come out of it easily. If things start to not function the way that they're supposed to, these fibers that hold the nucleus of the disc in place, they can start to actually tear. That nucleus can move towards the outside. That can start to create a bulge in the disc. And worst case scenario is the nucleus can actually rupture all the way outside of the disc. When this happens, it actually starts to just sit on the nerve, and that becomes a lot more difficult to treat. So definitely don't wait to seek out care when it gets to this point. You want to try to get things fixed when they're small problems, not big problems, because there's limits to what can be done at certain points. So if you're having any neck problems, if you know somebody who is, make sure that you share this, maybe tag somebody in the comments below, and we'll see you on the next one.